The Partnership for Health program is unique in that it is clinic-based. It's primarily delivered by the provider, and it is brief. It usually only takes a few minutes of time. The core components of the Partnership for Health strategy rest upon the clinical encounter. So it's not what they say, the provider says, it's how they say it. So it's asking open-ended questions, actively listening and not interrupting to the answers, redirecting back to the core messages that are being provided, being non-judgmental and supportive in health behavior change efforts, and assisting the patient in building their self-efficacy to address any problems or barriers they may experience in their behavior change effort. Developing an individualized adherence plan with the patient is another key element of the intervention. And a pill scheduler, for example, allows for a patient and provider to outline pill-taking behavior throughout a week. It also allows for the patient to link their pill-taking behavior with a specific behavior, activity, or schedule that allows them to remember to take their medicines. People's schedules change from day to day. What a person is doing on a Wednesday may look very different from what they're doing on a Saturday. And to the extent that the pill-taking behavior can be linked to a specific activity for each of those days is an important aspect of maintaining high levels of adherence. Why is the clinic such an important setting? I mean, this is a clinic-based intervention. And we selected clinics because oftentimes this is the only place where these patients receive any type of healthcare message or supportive healthcare at all, and it provides a unique venue in order to do so. The Partnership for Health program is leveraging the power of the patient-provider relationship in a collaborative way. To the extent that there is a partnership that's formed between a provider and their patient, tells the patient that the provider cares for them, and this provides a level of underlying trust that facilitates behavior change. It also allows for increased disclosure on the part of the patient about any problems they may be having with adherence, any issues that may come up, they would be much more likely to disclose that. Having the provider develop an individualized adherence plan for the patient is one unique element to this program. It provides a tool to give concrete solutions to barriers that may come up to maintaining high levels of adherence. And unpacking why or how or what one can do to get around those issues is an important element. Adherence is very important for people living with HIV. To the extent that a patient is not adherent, their disease may progress faster. They may develop a resistant strain of the virus, and this may also lead to a higher risk of transmission to others. So it's a very important behavior to focus on. So a patient starting ART for the first time could potentially benefit from this program in a number of different ways. First is the relationship that's formed between a provider and their patient that provides underlying trust that's supportive of maintaining high levels of adherence. There's the pill scheduler as well, which kind of eases concern about how am I going to do this, how am I going to take this medication every day. That provides support as well for building the patient's self-efficacy and confidence, and that their belief that, yes, I can do this, I can get through this. And then the repetition as well. The provider's bringing this up at every visit, and the patient begins to realize how important this behavior is, and that's also supportive. So a patient who has been on ART and is switching their regimen can also benefit from the Partnership for Health adherence program. For example, the pill scheduler can provide a framework for viewing behavioral cues or environmental cues they could use to maintain high levels of adherence to their new medicine. The provider can also help them identify a supportive other who can support their pill-taking behavior. The Partnership for Health program was originally designed to address safer sex among people living with HIV. And we needed a control arm to compare our safer sex intervention with. And we decided to do something that was very important for this population, and that is medication adherence. The prior literature suggested that providers can create quite a bit of health behavior change in their patients. So the prior literature shows that messages from providers to patients with regard to smoking cessation, improving diet, improving exercise, reducing alcohol intake were effective. And so we use this literature to support a clinic-based health promotion intervention within HIV clinics. In the original research study, we actually anticipated seeing an increase in adherence among those who entered the study with low levels of adherence. But we didn't see that, and that may be partially due to the fact that that was a relatively small group of patients. But what we did see was the maintenance of high levels of adherence among those in the intervention arm of the study. So we can say that this intervention has efficacy in maintaining high levels of adherence among patients on ART. So there are a number of things that a clinician can take into account when they go through this training. Oftentimes, clinicians think that they interact with their patients in a certain way, but their patients would not report that. They would report a very different experience. So one piece of advice would be to come into it with a very open mind and to understand that patients may not hear you the same way you think you sound. A second piece of advice would be to be persistent. This intervention was designed to be very brief, but to be repeated over time, every clinic visit, to raise this issue, because this tells the patient, wow, this is important. If my doctor's paying attention to this, I need to pay attention to this. And then a third piece of advice would be to be non-judgmental. So you'll hear a variety of different answers to the questions that you pose, and the goal is to be as supportive as you can with the patient, and to collaborate with them in problem solving and overcoming any barriers to their adherence.